Hello everyone, welcome to my channel. Today's video is about interview questions and answers for biomedical scientists. So I'll be covering as much as I can. And also if you stay to the end of the video, I'll be answering the questions regarding biomedical scientists in microbiology since I specialize in microbiology or infection sciences. So make sure you stay to the end. So let's go. Hello, everyone. Finally, the topic that everybody's been asking about biomedical science interview questions and answers. I must admit, is my least favorite topic. Talking about interviews, applications, this whole process is not my favorite. So, even going through this session is going to be a bit challenging for me. But let's go. So there will be general questions which are always going to be there, such as why do you want to work as a biomedical scientist? Speak about your experience. How do you describe your teamwork style? How do you keep up to date with the biomedicine, which is a new name for biomedical sciences, and what makes you a great fit for this role? So these are the general questions. There are other type of questions that are going to be based on your experience and backgrounds. Tell us about a colleague who questioned your findings. How did you respond? Describe your leadership abilities. Tell us about a time you made a mistake. What did you do? Do you have any experience managing laboratory quality, following ISO procedures, etc., which we're going to look into details soon. So again, we're going to start with the general questions or the common interview questions. Why do you want to work as a biomedical scientist? How do you stay up to date in biomedicine industry? What motivates you to pursue a career in biomedicine? And what's the most important part of being a biomedical scientist? So bear that in mind. You're more likely to be asked these questions one way or another. So now we're gonna go into details. So these questions and answers are what I have gone through on the questions that I came across several times. It's very subjective. I always say that in any interview it depends on the trust. So always learn about the trust values, etc., which I'm going to talk about. Is going to become clear as I elaborate on the points that I think are very important. So the first question: why do you want to work as a biomedical scientist, or why did you apply for the position, or that way of asking? So your ideal answer will be my interest in biomedicine started during my undergraduate studies or master studies, depending where you are, where I developed a passion for medical research and diagnostics. I'm drawn to the field because of its potential to improve patient outcomes and contribute to the healthcare system. Working as a biomedical scientist allows me to directly impact patient care, which is deeply fulfilling. So the key points in this answer, you talk about your personal connection to the field, passion for research and diagnostics, and direct contribution to patient outcomes. So also, this is very important. I wish I knew that when I applied for my first biomedical scientist. Appreciate the specializations that you are applying for. Obviously, you've done your generic. You might have done, like myself, trained in microbiology lab, and then you applied for immunology position. So make sure that you learn about the specialization. And just reiterate, I've spoken about this before. We've got different specialities: infection sciences, which includes medical microbiology, virology, or even mycology; blood sciences, which is the most common one; clinical chemistry, transfusion sciences; hematology, immunology; cell sciences, which includes histopathology, cytology; genetics and molecular pathology, which includes genetics, molecular pathology, cytogenetics. So make sure that you understand your specializations. This will help you to articulate your answer during the interview, because the interviewers will ask you about your area of expertise. So it's important to design your answer according to the speciality that you're interested in. As you know, I always like to share a story. I remember when I applied for an immunology position, the description was very, straightforward. The role was a band 5. As you know, we start as a 5 when you qualify, and then as you progress, you apply for a 6. So I was asked a very basic question about immunoglobulins, which is, what are the classes, what's the largest one, which obviously during the interview your mind will freeze because you're so nervous, and my mind went blank, and I knew I answered it wrongly, and I was really beating myself up when I when I came out of the interview because I remembered the answer. I think the interview was disastrous to my own level. Maybe I wasn't, obviously I didn't get the job, but that was a lesson for me. So make sure, if you say you want to get into molecular, make sure you read around the topic. Make sure that you nail, like now we're going to elaborate on the common questions. Make sure that you have those questions and answers ready according to the specialization. So I cannot emphasize enough on that. There's nothing wrong with, because when you become qualified, again, biomedical science includes all the specialities. So you can move into any other specialty that you like, but make sure you read around it, because if you've done biomedical science, you would have came across all of those disciplines. Even when I had to do top up modules when I embarked this whole journey to become qualified. So we had to study additional top up modules. As you know, you will, when IBMS assesses your degrees or your qualifications, they will ask you for top up modules. So I did the other disciplines. So it makes sense now that you will have to understand the discipline that you want to apply to. Like now, what's so hot from what I have seen in my travelings is the molecular. Now we are moving to molecular because it's quicker. So make sure that I think molecular is going to be the answer in the future, because many reasons, which I don't want to bore you with those answers. But the future of bear in mind the digital health, all the developments that are happening now because of technology. So have an open mind, which I'll talk about in upcoming videos, etc. But I want to stick to that point just for you to understand from a perspective when you're applying for a position for a biomedical scientist. So, just to remind you, the key responsibilities of a biomedical scientist: biomedical scientists are responsible for conducting diagnostic tests on patient samples and ensuring accurate results are reported to the medical team. The core tasks will include performing routine and specialized testing on biological samples, maintaining specialist lab equipment, reporting critical or abnormal results promptly, supporting quality management, compliance with health and safety regulation, and of course my favorite part, mentoring junior staff and trainees. So this is just to remind you, I've already spoken about biomedical scientist role in previous videos, so make sure that you check those out. But in this context, just to remind you what the role of biomedical scientist is. So another question: what motivates you to pursue a career in biomedical sciences? Your answer will be: what drives me is the direct impact in biomedical scientists have on patient outcomes, the ability to detect diseases early, assist in proper diagnosis, and support treatment decisions motivates me to continually refine my skills. It's rewarding to know that the data I generate helps saving lives and contribute to advancing medical research. So the key points in this answer: you show that your motivation is linked to patient care, your passion for diagnostics and medical research, and your drive for professional development, which is a key core role for biomedical scientists. So, you know what, I can personally relate to this question. It is a rewarding and fulfilling position when you become a biomedical scientist. And for me, as a biomedical scientist, I do enjoy my role, and I see the bigger picture, how my role contributes to health. So now moving on onto experience-based questions. And how to answer those questions. They will focus on how you apply your knowledge in real world situations. So there will be scenarios. For example, describe a time when you handle the unexpected results. How do you manage workload under pressure? Can you give an example on how you resolved a challenge case in the lab? And all these scenarios, I've come across them many times. And if you're a biomedical scientist, you must have come across it. Also, even if you're an MLA or an AP, you must have come across it. So these questions are real life cases, and they do happen. A question where: describe a time when you handle the unexpected test results. Your answer will be: during a routine let's assume a blood test, I've noticed abnormal results that we were inconsistent with the patient's medical history. I immediately flagged the results and conducted a repeat test. I consulted with the senior scientist and ensured the results were escalated to the clinician on duty. After a thorough testing, we confirmed a rare blood disorder, and the quick detection led to timely intervention. So, in this answer, you show that you have taken the initiative, you communicated well with the senior staff and the clinicians, you emphasize your problem solving skills, and you can use other examples in on which lab, for example in microbiology, which we're going to talk about later on questions that are specific to microbiology, because I specialize in microbiology, so I should share my the questions they will ask in the lab. Working in high pressure environment, oh god, now the labs are super busy. So this is, if you haven't worked in a lab, be prepared. But I think on all industries now the workload is very high. But now labs are very busy, whether you work for NHS or private, which I'm going to talk about in the next video about this hot topic that I've been asked several times. So handling pressure in biomedical science role, they often work in high pressure environments, especially in emergency diagnostics. So, the tips for handling pressure is very important that you demonstrate that you prioritize tasks based on urgency, maintain a calm methodological approach, communicate clearly with the medical team to ensure timely results. At the same time, you stay focused and maintain accuracy even under tight deadlines. So, the question that will come from this: how do you manage your workload under pressure? Your answer will be, or ideal answer, in a lab setting, I always prioritize urgent tests such as blood transfusion, matches, or clinical diagnostic tests for A&E patients. I maintain an organized workflow and regularly check with my colleagues to ensure smooth coordination. This approach ensures that I can manage heavy workload without compromising on accuracy or patient care. So here you show or demonstrate that you emphasize time management, which is a crucial skill. You show your ability to multitask without sacrificing accuracy. That's another skill. And also, you highlight your teamwork. So, these are very important for you to maintain your work or perform your work perfectly under pressure. And I can so relate to this because it's workloads now is, is very high. But the skills that you gain, I'm telling you, they don't just benefit you at work, they benefit you for life. You can manage tasks perfectly. You can handle pressure easily. For me, when I look at it now after a couple of years of practicing, it has helped me in my personal life, my entrepreneurial work. That's how I managed to do my other things at the same time with managing normal life. So these skills, I must admit, they are skills for life. You don't stress when things crumbling down. You just stay calm, you stay focused, you prioritize your work, what's more important, and at the same time your thinking is just, I'm telling you, I cannot, really really, if you really appreciate those skills, they will benefit you if you really focus on what you want to do and your goals. So these are one of the pros of being a biomedical scientist. So this leads me to another point which I really love: leadership and mentoring in biomedical scientists. And I think that's not spoken about much. Um, I'm sure later on I'll be sharing with you about this, but you do take leadership. You don't have to be a senior or a manager or a lead to become a leader, or to show that your skills with mentoring junior staff or overseeing lab operations. So that is another role of biomedical scientists. They take on leadership roles, mentoring junior staff, whether new joiners or experienced students or even medical staff, they can be there. So, and also you oversee the lab operations. So the key leadership responsibilities that biomedical scientists possess: providing guidance to trainee biomedical scientists, ensuring the team adheres to quality control and safety standards, managing lab workflow to ensure efficiency, communicating complex data to multidisciplinary team, because the team, you don't just deal with your immediate peers. You're dealing with medical staff, nurses, any professional staff who are involved in this ecosystem. So it's very important. So that is one of the skills that you will have. So the questions that related to that will be: how would you describe your leadership abilities? As a biomedical scientist, I've taken on mentoring responsibilities for new trainees, guiding them through lab procedures, quality control, and safety protocols. I believe in leading by example, showing attention to details, encouraging a collaborative work environment, and ensuring that all the team members feel supported. My ability to communicate effectively ensures that the complex data shared accurately with the medical team, enhancing patient care. So the key points here that you show leadership through mentoring, you emphasize the importance of communication and supporting your junior staff, and you highlight the importance of collaboration within a multidisciplinary teams. This is another bonus question you're more likely to ask, and I truly believe that will make you shine. Um, how do you stay updated with the biomedical scientist industry? I regularly read publications such as the Biomedical Scientist, the Journal of Clinical Pathology, to stay informed about the latest trends in medical research and diagnostics. I also attend professional conferences or meetings or webinars that are hosted by the IBMS, and participate in webinars on emerging diagnostic techniques. This helps me stay current and ensure that I'm applying the latest methods in my work. So here you emphasize that you are involved, you are up to date, and that you are dedicated to your continual professional development, or CPD. And this not just shows that you are only committed to the profession, but that you have a proactive approach to stay ahead in the industry. So add a bonus to that is which I truly believe that is very important. You should not just limit yourself to biomedical science. Obviously, the question will be about biomedical science, but I'll give you a tip: is make sure show that you are, which you might be crossing a line there, but to be honest, there is a misconception about technology that is taking away jobs and etc. But you can always use that to your advantage. For example, that you like to know more, you're interested, for example, about digital health, or the latest diagnostics, or etc., which I've explored myself. But again, be very careful about that, because sometimes some people don't like technology, and I've had that comment recently, and I was offended. Someone said that they've installed the machine, which I was excited about, but I've dealt with one newer to that, and I said, "Oh, maybe that would have been better, etc." And then a senior said, "Oh, they're going to take away our jobs. We're going to end up jobless." And I was really offended by that comment. I didn't like it. I thought, people still think like that. No, technology is not going to take away jobs. So for me, I turn it around and I would ask the panel, how do you feel about technology? Just to, when you, at the end of the interview, they might be asking you, do you have any questions? I always ask that question for my own learning. And so far, most of them were positive about it. They think that the technology is going to, the last interview I had was years ago, but the answers were varied. They were positive. They see it's going on a positive direction, but be careful. Sometimes the person who might be interviewing you might not like it. They might think, no, I don't like it. So that that comment of that person made me think, maybe if at an interview you ask that question, they might turn against you and then not give you the job. So be careful, because I don't want you to say, I just said this and then I didn't get the job. So another question, which you might be aware of, the ISO standards, especially the 15189. So you might be asked that question. I was asked in one of the interviews. So be prepared for that and memorize it. The, yeah, what do you tell me about what you know about ISO 1589? So The ISO standard governs laboratory compliance. This makes it essential for the role. So the interviewer wants to know that you understand the importance of the requirements of the framework, can operate within it. So your answer will be ISO 15189. I'm sorry, I didn't say what ISO stands for. So write in the comments because I forgot. And I don't remember it on top of my head. So guys, if you know what ISO is, comment below and let everybody benefit from it. So if you want that answer to the question, check it out. Or if I remember, I'll write it down, but I more likely will forget. So it manages the quality and competence within the medical laboratory. It takes a cyclical approach to quality assurance and places a strong emphasis on good leadership. The technical standards apply to areas such as laboratory equipment, environmental and accommodation conditions, consumables, examinations, reporting, examination processes, reporting results, information management, and personnel. Laboratories work to the standard as part of recognized approach to quality assurance. As a laboratory worker, this means that biomedical scientists work to strict processes and protocol. The way I understood it when I was studying to get qualified, the lab has to adhere to this or they lose their accreditation. That's how I understand it. So I've read it to you guys and it's in full detail for you, but you can create a simpler answer for you because again, I'm trying to put as much information as possible out here, but then you can always simplify the answer for you in order to, I always believe in bite sizing. I could have done it in a simpler way for you, but I want you to know it fully first and then you can simplify it to your own understanding because I truly believe in the importance of simplifying communication. So I apologize if it's in full detail here, but there's a reason behind it so you guys know it in full. So this is my favorite part. How do you adapt to a new laboratory equipment? It's very in the NHS, but it happens a lot in the private if you end up in the private. So be prepared for that question as well. So your answer will be medical laboratory may invest in new equipment. So this way you can show the hiring manager that you're adaptable and ready to work in many ways. So, like myself, I would say this. I'm always excited when there's a new technology comes into the lab because it's a chance for us to work better, smarter, and deliver a better service for patients. I always attend training sessions. I like to read the clinical manual in depth as I get to grips with the technology. Where the new equipment or technology has been used in research, I always like to find and read recent research papers. Through this research, I have been able to flag up details of new technologies and innovations in my team. So this is especially now with technology, with the adaptation of technology and the revolution of healthcare caused by technology. This is one of the questions that you might be asked, or you can throw it in one of your answers. See how the interview happens. So my final tips for you guys to succeed in the interview: always review, like I said, the common questions, the latest industry trends by simply just this is how I used to do it, or I still do it. I go on Google and see what's the latest, and then I tab on the news section and it comes up with the latest. So at least I have an idea. And to be honest, when I'm using LinkedIn, I see all the latest stuff out there. So it really helps me. That's how I stay up to date. I know I didn't know that many of you don't use LinkedIn. I was actually shocked. And there's a topic that I'll be talking about because I really benefited from it. So I apologize for my ignorance about that. So also use the STAR method to structure your response. If I think STAR stands for situation, no, task. Guys, comment below where it is. I've written it somewhere and I forgot. STAR method to structure your responses. So basically, you think of the task and then the solution, more like it. So actually, I can check it now since this is my channel. I've written it somewhere, but I forgot. So let's Google and find out what STAR stands for. Stands for. I always forget. So yeah, I was right. So situation, task, action, and results. It's a technique used to structure your answers. So always have that in mind. Oh, just think, what is the situation? What would you do? and what would be the response. So, and make sure that you stay confident when you discuss your technical skills, regardless to what walk of life you belong to. And preparing your questions for the interviewer, it will show your interest for the role and the organizations. For example, if you ask them, "What's the training like?" This is the common questions I always ask. I always ask, "What is it you're expecting? Who's in case if I don't get the job, so at least I know where I failed," because most of them don't give feedback because of they're too busy to do that. So I always ask, what is the expectations of the best candidate, what's the training like, and I always ask also, what do you think about, if I'm applying for a microbiology job, I always ask, what do you think the future of healthcare, for example, things like that. So just show that you are, and that will come with practice. You'll find yourself shining at the end of the interview. But I always ask about, what do you expect? So at least if I don't get the job, I know where I went wrong. So as I said, I wanted to share, since I specialize in microbiology, I thought it would be fair to share the questions that you might be asked if you apply for microbiology or infection sciences. Let's start again. So it's the same set of questions, but it's designed if you are applying for a microbiology role. So why do you want a biomedicine or biomedical scientist specialty in microbiology? My interest in microbiology began during my undergraduate studies, where I explored the role of microorganisms in diseases, and the ability of pathogens to adapt and evolve fascinated me, and I became passionate about studying how to control and prevent infection sciences. Working in microbiology allows me to contribute directly to patient care by diagnosing infections and aiding the treatments of life threatening diseases. The impact of microbiologists have in preventing outbreaks and ensuring public health motivates me to pursue this role. So the key points for this answer is, you show your passion for study of microorganisms and diseases, interest in controlling infections and preventing outbreaks, and your desire to contribute to public health. The next question, which could be, how do you stay updated the microbiology field? I regularly stay updated through professional journals such as the Journal of Clinical Microbiology and Infection and Immunity. Additionally, I attend microbiology conferences, webinars, and online training courses hosted by the IBMS and other professional bodies. I'm also active in a member of microbiology forums where professionals share insights on emerging pathogens and techniques. Key points to emphasize here is specific journals, conferences, engagement with professional network, commitment to continuous learning and development, and you staying current with the diagnostic techniques. Tell us about a time when you identified unexpected microbial infection and how you handled it. During my time in a clinical microbiology lab, I encountered a case where a routine test for a urinary tract infection, or UTI, we refer to it here, yielded unexpected results. Instead of a typical E. coli, or the sample showed the presence of Candida albicans, which is yeast. So instead of bacteria, yeast, indicating fungal infection rather than a bacterial one. But both of them are common, they can be found, to be honest. I immediately flagged the results, performed confirming tests, and I informed the clinician by detected the fungal pathogen early. The patient received antifungal treatment promptly, which led to a swift recovery. So here you show your ability to recognize any results that we are unfamiliar with. You take the initiative to confirm findings, and you communicate with the clinicians to ensure timely treatment. So this is a good question. How do you ensure accuracy in your laboratory work, particularly when it's very busy? So I've missed that word. I apologize, but that's similar to the question with it comes under the question of the busy workload. So accuracy is a critical in microbiology, which is very true, especially when identifying infections agents. So adhering to laboratory protocols and quality controls measures is very important. So before testing, you calibrate your equipment, which that works on everywhere, not just in microbiology, and ensure reagents are within the expiration date, correct. During testing, you perform aseptic techniques to prevent contamination. That's part of infection control as well. And after obtaining results, you cross-reference with the control samples, retest if necessary, and you document your steps carefully to ensure traceability and accountability. So you show your adherence to the protocols or SOP, focus on aseptic techniques and preventing contamination, and use of quality controls and cross-referencing to ensure accurate results. How do you describe your teamwork style in a microbiology laboratory? Teamwork is very important. So in a microbiology lab, teamwork is essential, especially when handling large volume of samples and ensuring quick turnarounds for critical cases. I work closely with my colleagues, maintaining clear communication, especially during shifts when handing over tasks. I support team members by sharing knowledge and assisting with challenging cases. And I encourage open discussions during team meetings to ensure that we are all aligned on protocols and priorities. So here you demonstrate the importance of clear communication and task handover, collaboration, when you are solving problems and supporting colleagues, and alignment with the team goals and protocols, and obviously the values of the trust or the hospital and the team. So tell us about your experience with antibiotic sensitivity testing and how you interpret the results. Antibiotic testing is a routine but critical part of microbiology. I use methods such as disk diffusion and broth dilution. Yeah, we got to the broth dilution these days now because of the difficulty to determine susceptibility of bacterial isolates to antibiotics. When interpreting the zone of inhibition, I compare it to established guidelines. For resistant strain, I consult with the clinicians to suggest alternative treatments, ensuring we prevent development of antibiotic resistance and while effectively treating the infection. So here you show your familiarity of the testing methods, whether disk diffusion or broth dilution, or also now we use the MICs. There's technology there as well. So depending on where you work, there is Phoenix they use. So you just want to show that you know what type of testing we use and the guidelines for interpretation. Here we use UCAST, and the importance of you communicating with the clinicians about the treatment options. I've noticed that a lot in the NHS. The private is fairly different. How can I say it actually? I'll talk about that in the next video about the differences, but this is the model answer. But it was very interesting for me to explore it both ways. In the hospitals, they work closely in person with the clinicians, because the clinicians, they will come around, they will come to the bench and ask, is there anything you want to you need help with, or is there anything you want to tell us, etc. But in the private, it was completely different. It was electronic communication. It was more virtual. You will have one consultant coming around, but that's how the communication used to be. So that was very interesting to explore when I worked in both private and the NHS. So this is it can happen. So that's expect that question. How would you do if you discovered contamination in a microbiology test result? The first thing you would do is isolate the source of contamination, involve reviewing the sample handling, media, or equipment use. I would discard any compromised samples, decontaminate the work area, and retest with fresh samples. Additionally, I would document the incident and communicate with my supervisor and ensure the systemic issues are addressed, such as revising the protocols, retraining the staff on aseptic technique. Here, you emphasize that you have the ability to identify and isolate contaminating sources, follow proper decontamination procedures, proactively communicate to prevent future contamination issues. The favorites. How do you ensure that laboratory procedures in microbiology comply with ISO 15189 standards? Compliance with ISO standards is essential for maintaining laboratory quality and safety. In my current role, I ensure that all procedures from sample collection to results reporting adhere to the standard guidelines. I actively participate in internal audits where we assess whether our processes meet the required quality standards. I also contribute to maintaining accurate results records, documenting each step in testing processes to ensure traceability, and regularly calibrating equipment to meet compliance requirements. I've already explained what I saw there, so hopefully by now you would have had an idea on how to answer this. So here, You emphasize your experience with internal audits and compliance, commitment to quality control and documentation, understanding the importance of calibration, and adhering to procedures. How do you handle situations where clinicians question accuracy of your microbiology results? You approach the situation calmly and professionally, very important. First, you review the test procedure, ensure that all steps were followed correctly. If necessary, I will repeat the test or perform additional confirming testing. I maintain open communication with the clinicians, explaining the methodologies used and the interpretation of the results. My goal is to ensure the clinicians has the confidence in the data, and I'm always open to re-evaluating findings if needed. Calm and professional approach to feedback. That's what you want to emphasize. Willingness to retest and confirm results. Clear and open communication with clinicians. The reason I'm smiling because that can happen. Everybody's so busy. Sometimes there can be misunderstanding. But what I like is the professionalism is still maintained, especially in the NHS and the private. Again, you might have somebody upset when they speak to you. You have to understand there's a patient at the end of it. So for me, I never had a problem with that. We calm them down by ensuring, you reassure them, but never ever take it personally, because at the end of the day, there's a patient at the end of it. So always have that sympathy when you have a professional clinician speaking to you. So that's where I want to think when you answer this question. But if you face this situation, bear that in mind. That's how I handle it if I have a difficult person on the other end of the phone. How do you handle a high workload in a busy microbiology lab? In a busy microbiology, time management is key to handling workload. I prioritize urgent tests, such as those related to critical infections or emergency transfusions. I organize my day to tackle routine tests efficiently while leaving room for unexpected tasks. I communicate regularly with my team to ensure we're all on the same page regarding urgent cases, and I assist where needed to ensure workload is balanced, and I maintain focus on accuracy even under pressure to ensure no compromise on test results. So here you show that you have a strong time management and prioritization, collaboration and communication with the team. At the same time, you maintain in accuracy and focus. I cannot emphasize on how important to that skill and how you handle it, because we are experiencing that in real life. It's very busy now. As I'm recording now, I'm really tired. It's been very busy recently, and I'm not even doing shifts, which I'm going to talk about in the next video about the private and the NHS. So that's a very important skill to have, is to be very organized. This is a tip I will tell you, because I know when people come from abroad or even new people, they see how it is, but it's manageable, it's doable. You just have to know when you need help and ask when you need help, and be open. Communication is very important. So what's your approach to working with new microbiology equipment or software? I get excited personally. So your answer will be, I always welcome new technology in the lab as it allows me to work more efficiently and accurately. Where we implement new equipment or software, I ensure that I attend any available training sessions and I thoroughly read the user manuals. I also practice with equipment under supervision until I feel confident using it independently. Additionally, I like to stay informed about the best practices by reading the research papers or industry guidelines relating to the new technology. So, here you show your enthusiasm to new technology and innovation, commitment to proper training and practice. You stay informed with the best practices and updated and any updates in the field. I love this question as well. What are the biggest challenges facing microbiology, and how do you think the field will evolve? You can even use that question to ask the interviewer. Remember earlier on when I told you, when you end it, few of the questions you can use that and design it to the discipline that you're not just in microbiology, but you can use it for the discipline that you apply it for. But if you get to ask that question, also ask them that question just to show that you are there, you're eager to learn. So your answer will be, one of the biggest challenges in microbiology is the rise of antibiotic resistant bacteria, which is true, which makes infections harder to treat and control. To address this, there is a growing emphasis on researching alternative treatments such as bacteriophages or antimicrobial peptides. Another challenge is the emergence of new infectious diseases due to global travel and climate change. So I believe this field will continue to evolve with advancement in molecular diseases, rapid testing technologies, and a greater focus on personalized medicine to tailor treatments based on individual patient data. So here you show that you are aware of the current challenges, such as antibiotic resistance and new diseases, your optimism about advancement in diagnostics and treatment, and your understanding on how microbiology intersects with broader healthcare trends. And this is something I'm very passionate about. And I've traveled and I've attended international conferences. Is very important, and this is something I will elaborate more on the importance of networking, whether in person or virtual in person. I've attended so many webinars, international webinars, and it really, really opens up your eyes. So don't just think of just networking in regionally. If you're in the UK, only in the UK, try and explore. So when you're preparing for your answers, make sure that you showcase your technical knowledge, experience, and problem solving skills, because that way you will demonstrate your competence as a biomedical scientist, whether in microbiology or any other discipline. Each answer will reflect your professionalism, your critical thinking, and dedication to patient care. And these are the key attributes for succeeding for this role. And as I always like to emphasize, or if you're applying for, let's say, if you're applying for a band five, prepare for a band six questions. Because this is from my own experience. They always ask you one band higher to challenge you more and see how much you know. And this is what I've been hearing recently where I'm working, like, if people are applying for an MLA job, sometimes they ask them specific questions. Sometimes, so always prepare extra. So if you applying for a band seven, I haven't done band seven. As the highest I've been is a band six. Prepare for advanced questions, managerial questions, etc. So that's beyond my. But I will be having guests who will be sharing their experiences. So always challenge your questions and ask yourself more. Be prepared for. You'll always have one person who will ask you extra to see how far they can push you. So there are more questions. Again, this is very subjective. Always bear in mind it depends on the trust, it depends on what they need, it depends on who they're looking for, many things. So always have room for more questions. This is not all of the questions you'll ask. I've just put what I have, the questions that I've had in my journey, and the most common questions. So be prepared to other questions. For example, how do you create a culture of effective communication in a workplace? What do you see as the biggest challenge and opportunities facing, let's say, the NHS or National Health Service? How do you facilitate effective working practices within laboratory setting? And when you answer these questions, you go into detail about your practical experience and your problem solving techniques or strategies. So, for example, if you're asked about creating effective communication, you can talk about the importance of fostering open dialogue, regular team meetings, and setting clear expectations. So, have an open mind about the questions. Don't think that's the only questions you'll be asked. Be prepared. Again, my final tip is make sure that you check your understanding. Don't be afraid to ask for clarification on any technical questions or any questions that you're not sure. Don't rush your answer. Take a deep breath and speak clearly. I know it's very difficult, it's nerve wracking. Nobody likes interviews. Prepare your questions, research about the role, come prepared, and have thoughtful questions for the interviewer. For example, you might be asking the hiring manager, what are the biggest opportunities or challenges within the role, like I mentioned earlier, or what kind of internal reputation or service delivery record the laboratory has, etc. Just think of it like one of my guests on my podcast said, they start and enjoy the interview session. So maybe if you look at it that way, which I really like, just look at it like, do I really want to work here? Like one of the videos I've seen. So maybe look at it from that aspect. So I hope I've helped you guys. If you have any questions, just drop me in the comments. Let me know if there's anything that you want clarification or if there's any correction. As I said, it's my least like task, applications and jobs and interviews. But I just thought if at least I can give you help in this. And I know a lot of you have been asking me, but sorry, I had to put it all together. I tried. Again, one final tip I would share with you guys. Remember, look at the person's specification because that's where they're looking for, and have an idea on the job description, and they always have a downloadable link somewhere. When I'll be showing you, I know a lot of you asked me how to apply, so that will be an upcoming video very soon. I'll show you, but based on that the questions will come, and research about the trust. What's the latest about the trust or the company? What are their values, the core values? They always like to ask that question to see if you're prepared. So yeah, and remember, preparation is the key. Practice your answers and stay calm during the interview. That will make you shine as a top candidate. So I hope this has helped you guys. As I said, I don't like the application process, the covering letter, the interview preparation. The interview, not so bad. I do like the interview, but bear in mind, this is very subjective. You have to appreciate that it depends on the trusts. So make sure that you check the job description, the person's specification, particularly what they base their questions on. And also check the trust values, very important, because they will always ask that question to check if you know the trust that you're applying for or not. And also check the latest developments, or let's say if you're applying for a private company or diagnostic lab, make sure that you know what's the latest. And the same applies for the NHS. Check, for example, what they are working on, what's their current research, and the same for the NHS. So have an open mind, always be prepared, and make sure that you ask that question to the interviewer, because that will make you shine. And also, like I said, I always ask the question what they expect in the successful candidate. So at least if I'm not successful, I know, because they don't always give feedback. So if you like this video, please like, subscribe, and share any comments or anything that you want to know, or anything that you want me to share. Make sure that you click on the comment section below, and make sure you subscribe, because I really want this video to benefit as many of you out there, especially now we've got loads of students who are or graduates, or even people who are looking for their next role. I hope this helps them. So all that content that I share out there, I really hope that you guys will benefit from it. So until next time, keep shining, keep inspiring, and see you next time.